This is Average Joe PT, and on this episode, we're going to talk a little bit about the hip. So we're going to talk about why you might be having some hip pain, where is that snapping and clicking coming from. So that's what we're going to talk about in this episode, so stay tuned. Whenever we have any type of clicking or snapping that's occurring down in our groin hip pain area, we start to kind of think about, what's going on? Especially when it starts giving us some pain with that clicking or snapping. Now, all of a sudden, the red flags come up. It's like, oh God, what's going on with this? I'm getting pain. Did I do something to my hip? Did I do something to my back? Where is it all coming from? So today, we're going to talk a little bit about that clicking. Why the heck is that clicking going on in the first place? There's a ton of stuff on the internet that talks about this one big muscle called the Iliopsoas muscle. It runs down in the front side of the hip and comes all the way underneath your groin and attaches on the other side. That muscle is massive, and that muscle can give you some of your problems, but not always. Now, you might feel like it's coming from that area, and it might give a little bit of click, but that isn't where your pain's coming from. Now, they'll go ahead and show you that particular lunge stretch out on the internet that basically shows you stretching that iliopsoas muscle. But if that's not where the origin of your pain is coming from, that might actually aggravate it even more. Most of the time, that clicking pain is probably coming from a labral tear, or it's number two, coming from maybe some osteoarthritis in the ball and socket area, where that area kind of gets worn, where that ball and socket meet. Next thing you know, you hit that ball and rotate inwards, or maybe try and sit crisscross or Indian style air type of position, and that might be why you're having that, because you're catching where that arthritis is at in the ball or where that labral tear is. Now, I have a few videos all about how to treat labral tears and clicking, snapping, hip stuff. You can go ahead and look at that on the internet. This episode, we're really talking specifically about when you have that clicking, what do I need to do? So, exactly, what do you need to do? You need to first stay off of it for a couple days just to give it a rest. If you're a runner, or if you're doing a lot of squatting or kneeling or any type of those high impact activities, you're going to want to stop that for a few days and just see if it's just inflammation. It's none of those things that we talked about previously. The clicking, the tear, the osteoarthritis. If after about 72 hours of taking some ibuprofen and some anti-inflammatory and some ice and rest, and those don't go away, then we're talking about one of those three things. If it's the least aggressive one that's causing the clicking, it's the iliopsoas. If it's coming from a labral tear in there, where it's frayed and it's catching every time you get in a certain position with that hip, then it's probably that. If it seems like I move and walk, leg goes out to the side, leg goes in, leg goes out, doesn't matter, I'm always having pain, then it's probably osteoarthritis of the hip. What the doctor will do is when you go and see them, they're going to start with what I just told you, resting it, some anti-inflammatories, and see if it makes it go away just by that. And if it doesn't, they're going to send you to some therapy, physical therapy or physiotherapy, depending on what country you live in, and they're going to diagnose one of those other two things. Either it's a iliopsoas issue, which more times than not, it's not that. Labral tear, which really, until you get an MRI, kind of gives you the gold standard of if that's the cause or not, or some basic osteoarthritis. Now, you can do some strengthening exercises, and sometimes, more times than not, it isn't. Strengthening it's actually going to help this, because strengthening sometimes can actually make this a lot worse and get things inflamed and cause more problems than not, especially if it's a decent labral tear or if you have pretty good osteoarthritis in there. The osteoarthritis is going to be diagnosed easily with an x-ray. An x-ray will come up and just show how much wear is going on in that ball and socket. The doctor will be like, that's what's causing it. What can you do at home? You can do the ice. You can do just a little bit of stretching that I showed in one of my other videos that I'm going to leave a tab up for. You could do it there. If it's bad enough osteoarthritis, then they might give you some injections and see how that feels. I have a video out on that. I'll just leave a tab on some basic injections to the hip. that they can go ahead. A lot of times they'll diagnose you with bursitis, and they'll do an injection in that. Otherwise, they might talk about, if you're old enough, which would mean in your 40s or 50s, a hip replacement if it's coming from osteoarthritis. If it's coming from the labrum, they might do a repair on that depending on how old you are. Now, I have a video specifically on that, and you can go ahead and look at that particular one that goes over the type of repair that they do if you're kind of curious and worried about what will that, look like. How much will I need to recover? If you guys have any questions, go ahead and leave them down below. Kind of do try and bring videos at least a couple times a week. Ring the bell. Love to have you guys subscribe. If not, hopefully this content's helping you out a bit. Now, when we finally finish up here, we talk about those three things. Either it's the iliopsoas, a labral tear, or osteoarthritis is causing that clicking hip pain. You also want to think about just giving it that break that I talked about early on, and really break, not just, oh, I'm just not going to run, or I'm not just going to stand a lot. I'll give it a little bit of a break. You have to really rest this hip for at least 3 days at 72 hours in the ice, the area, for 15 to 20 minutes, at least 3 or 4 times a day, or when you're not at work. And take the anti-inflammatories that really help decrease some of that pain. And unfortunately, if it's not going to help with those types of treatment techniques, then it's probably the other two things. It's either the labral tear or the osteoarthritis that's got bad enough in your hip. Now, like I said before, we try and bring this content a couple of times a week. And if you feel like you don't want to, talk about what's going on in regards to your hip, you can always DM me. Hopefully I can help you out there. But until next time, I want you to look up and keep smiling. See you next time, folks.